everybody. Welcome back to the podcast. I'm Dr. Lindsay Renzullo.
I'm Dr. Christopher Nolikin. Today we have Dr. Mike Hornberger here, and he's joining us because we decided to do a whole show about senior pet care. Dr. Hornberger is one of our fellow general practitioners, but also recently was certified in Canine Rehab, Rehabilitation medicine. So congratulations, first of all, on that.
It's a big accomplishment.
Do you want to just tell us a little bit about what rehab is and what that certification means?
Certainly. So Canine Rehab is working with our pets to help increase their range of motion after an injury or as they're getting older and they're starting to, decrease their abilities, their physical abilities, and that kind of thing. After a surgery, it helps to speed up recovery. It helps them to get back their strength and their ability to go to what they've always done. In human medicine, we always think of this as physical therapy. Mm-hmm. And in fact, Canine Rehab is practiced by both physical therapists, human physical therapists, and by veterinarians. And they were trained in the same place, and I am called a CCRT. And it's called Rehab for veterinarians because I didn't actually go to the training that a physical therapist goes to, and they are certified as canine physical therapists as opposed to veterinary rehabilitators. Mm-hmm. So, but both of us go to a similar program. It's 3 5-day sessions, and then there are online courses and a 40-hour internship as well.
Mm-hmm. Oh, very cool.
Yeah. So effectively, if a person was seeking out the type of services that you provide, they would either be looking for a rehab practitioner like you,
right,
or a physical therapist, and those are very sort of similar in a way. It's just that
the treatment is very interchangeable.
Right.
It's just different nomenclature,
just different
depending
nomenclature.
on who's practicing.
And basically, a physical therapist who practices with canines would get in trouble for saying that they do rehab, and you would get in trouble for saying you're a physical therapist because it's just the certification.
Exactly.
Okay.
Yeah.
So not too confusing. Just a little.
Just a little.
Yeah.
So you said that you help a lot of patients post-injury, and as they get older, even post-surgery, I'm imagining you're helping a lot of these patients too. What is a typical patient that you get, and how would you sort of help them through that process of recovery?
Certainly. There are a couple different types that I get. Most common. One is our elderly patients, and they're starting to face some arthritis. And one of the big things is, like in people, if we have a joint that really hurts, we start to compensate. And so that joint needs help. And it can be surgery, or it could be medicine, anti-inflammation, that kind of thing. But also the rest of our joints start to contract a little bit as we're compensating. And so we get restrictions in the motion of all of our other limbs too. And so what we're working with is trying to bring down the inflammation and pain in the affected joint, that's like our biggest one, or in that affected muscle. Sometimes there's a sprain or a strain. And so through medicine, and then for myself through doing massage therapy and range of motion, and then exercises, and then sometimes with things like laser therapy or with a TENS unit, and then also out there are things like underwater treadmill and ultrasound. We're able to use different modalities to try and reduce the pain in that moment. And then I work with the patient and with the owners to go through in-clinic massages and joint mobilizations to reduce that pain, and then give little bits of exercises, steadily get more and more and more progressive, so that our patients are able to do more and more at home, and that the owners are able to kind of lead them through more and more at home and become less and less reliant on me for them to feel good, and hopefully less and less reliant on things like non-steroidal anti-inflammatories.
Yeah.
Sometimes they really are required to have those for, sometimes it's a short term. If it's a really elderly animal, maybe it's long term, but at less of a level of those anti-inflammatory medications. And same thing with surgery. Sometimes an injury is bad enough, you need surgery.
Yeah.
And other times it's that surgery is a traditional thing that we do, but maybe in this older patient it's not like a full tear of a ligament, but it's a partial, and maybe we can kind of help them through. And I assess kind of mobility, and I'll talk with our surgeon too, and we'll talk, is this a level that we think has enough inherent stability that we can keep working this way, or do we step to that next level?
Mm-hmm. Yeah, I think that the field of physical therapy is something that most people in human are very familiar with. You have an injury,
right, and
you're prescribed physical therapy automatically, right?
Right.
It doesn't almost matter. You have a surgery, you have something that happens, and you're going to PT. Yeah. And in animals, that's been something I think that's been relatively neglected. Post-op cases, we just kind of set them loose a little bit. Sometimes we give owners little exercises. I know our surgeon has always been really proactive in that.
Yeah.
But it's something that really can speed recovery and just gets get them back on their feet, maybe even help them not to rupture their other ligament on the other side, right?
Exactly, yeah.
And I think people, maybe they're resistant about just the patient compliant factor, about whether or not their patients are going to sort of be okay with this. And I guess you would sort of assess those cases you assess that on a case-by-case basis. And, it's quite surprising how many patients really do enjoy it. It almost like feels good, right?
Yeah.
So, where you might sort of think that they would be reluctant to have it, they seem to like the massage therapy. It seems to be beneficial, and especially
who doesn't like a good massage?
Oh, I know. So true. And especially when you give them the techniques to go to home and actually use it at home, too. That's
so
nice.
Do your owners typically follow those exercises?
The level of follow through varies definitely.
That's what,
and I'll work with.
Yeah, humans are the same way.
Yeah. Human physical therapists are often surprised when, like my husband. I mean, tell little individual stories, but my husband was prescribed physical therapy, and the physical therapist was like, "You did the exercise."
Right.
Oh yeah.
We're in the same thing.
Yeah. But so what's a typical? So let's say you have a senior pet, and you're doing your rehab in office.
Yep.
And this is, let's say, the first time you're evaluating, and it's just a kind of a moderate arthritis situation. How often are those clients usually coming back to you versus how often are they doing exercises at home?
So a typical thing that I'll do is if I have an acute injury, and that can be like the acute on chronic, a dog that's always had arthritis and now they took a bad step and bam, it's like somebody with a bad back.
Yep.
It's always there and then it goes bad. I'll try and have people come in twice a week for a couple to a few weeks, if they can. Typically, like about 2 to 4 weeks of twice a week on a moderate type of a thing, and then we'll try and go to once a week, and then most of it goes to at home. And at home, what I try and do is to have people do either every day or every other day exercise, and we start really light. So during the acute phase, when it's really inflamed, they don't do a lot. It's mainly helping their dog through a little range of motion. I might even teach them a little bit of area massage and that kind of thing. And then the first things they do, just like with people, is stretches. And I'll teach them, and it's funny, you don't think of stretching your dog, but you can stretch your dog. We use cookies to lead them through different things, and they'll do different bends or reaches or things like that. And then as they get stronger, then they start doing more exercises of sideways walking or sit to stands, which are essentially squats for dogs and things like that. We kind of keep working through that.
I'm picturing a little dog on an exercise video now.
Yeah, right? That's kind of what it is. But I'll have people that say, like, I can only come in once a week. And that's okay.
You just work with it. Yeah.
That means it puts the onus on the owner to do more at home. But I've definitely had a number of dogs do really well just coming in once a week.
And some of the other modalities that you offer, like things like laser therapy, that's very exciting. I feel like they use it a lot in human medicine, and I think it's now starting to spill over, just like, Dr. Van Allen mentioned about PT being not really as in vogue in veterinary medicine. This is also something that's kind of up and coming. And so just talk to us a little bit about what is laser therapy, and how does it kind of help these patients?
So laser therapy is a modality where the laser itself does add heat. People always say, so is it adding heat? Is that what it is? And it does. It definitely heats the area. And heat allows our muscles to relax a little bit. And so we start to feel a little bit better. It's like putting warm compress on. But it's more than that, because if it was just that, then you could just use a heating pad. Yeah. So it also works at the cellular level. And what it's doing is it's providing energy. And it actually helps the cells to have more energy to clear breakdown product and start to heal and have the energy to heal itself. It helps to reduce some of the fibrosis and then the stricture that's happening in the area and that kind of thing. And the way I always think of it is like kind of the way that the sun gives energy to trees and plants and stuff like that. The laser is doing that same kind of thing, but for our cells.
Yeah, I like that. I like that analogy.
Very cool. Yeah. So, what about cats? Tell us about cats.
I feel like we're talking a lot about dogs, but...
So
you told me about that you're starting to work a little bit with cats.
Yep, I've had a couple of cats come in, and it's really fun. It's funny in two ways. One is dogs certainly are more willing to be trained, and so you can lead them through stuff better. But I have had some cats come in where, like, I have one right now. It's an older cat, and she just hasn't been able to jump onto the same area she used to. And so we started using the laser therapy and doing massage and doing like some range of motion. I don't lead her through exercises.
Yeah.
I'm not at, like that. That's a little tougher. But just doing the massage and opening things up and getting the laser on there. Already the owner in the last few sessions so she jumped on the first time she jumped up and onto something she hasn't jumped onto, and then she came in last. She was like she did 3 vertical leaps.
Wow.
So so starting to feel
She's
better.
17 too. It's a 17-year-old cat, so that's pretty impressive.
Yeah.
Yeah, and cats can be trained, because right now I'm watching America's Got Talent with my kids,
Yes.
and there's a team that train their cats.
Train their
It's
cats.
really pretty
Cats,
impressive.
I think that they're just a little more like, what's in it for me?
Yes,
than a dog
totally.
Maybe is.
Yes.
But
Oh, for sure.
I guess it depends on the patient. There are probably some cats that you couldn't do massage on. I know one of my cats
some of them
definitely
you
couldn't.
But
There was and again, this is a little segue, but there was a circus show I went to, which I know is controversial anyway, the circus stuff. But they had a whole session of dogs, and then these cats came out. It was a herd of cats.
A herd of like domestic cats.
Domestic short hairs. That they were teaching them all these jump through hoops. I was literally floored watching what cats could do. So I do think that with the right cat and the right persuasion, you can get them to do it. But I think the laser
and I have had cats too. I had one cat. Unfortunately, in this cat, it didn't work. And this is again where I stay in contact with our surgeon, right? So this cat actually had jumped and had avulsed some tendons. And we tried to see, can we strengthen the surrounding muscles enough to cover for what wasn't working anymore.
Yeah.
And we did get that cat to, like, the owners would hold her at home and kind of walk her, and she'd walk just on her front legs. So she'd try, and they'd lift her up and down, so she'd actually kind of do one of these, and use those. So she went through everything she needed to. Unfortunately, she ended up needing surgery because it just, her body wasn't able to do what it needed to.
I mean, you needed
but
cat
she did
dumbbells,
the exercises.
little cat dumbbells. That would have done it.
Yeah. But it's I mean, cats and the feline patients, even though they're not as amenable, sometimes, we don't have as many medication options per se. I mean, we have non-steroidal anti-inflammatories in cats, but they're just much more sensitive with their kidneys, and so I just feel as though these patients, if they could respond, it's really great, especially for the ones that have a positive response. So for the patients that are like post-op, do you have certain protocols that you'll follow through for like a typical patient that's getting, a cruciate surgery, or things like that? You have certain protocols that you follow with those patients?
So it's kind of in between. It's kind of guidelines.
Yep.
And so, it has, what it is, it holds for whether it was a surgery or an injury or whatever. There's a general progression that I'll kind of expect a patient to go through.
Yeah.
But there's definitely measurements, and you see what fits, and there are certain things I'll do within certain measurements. So there's certain exercises that I'll do for them. And then people say,
depending
so
upon
is it like
how much weight they're bearing or that kind of thing?
That's exactly it. Yeah, you do strength testing, and it's like, so you have non-weight bearing, partial weight bearing, and then you can actually do strength testing of, like, if they can stand on a flat floor and I can lift one of their limbs and the other limb doesn't drop, the effective limb doesn't drop, then that's a grade 3 of 5 strength. And if I then take them over and have them put their front legs up and their back legs are down, so they're carrying more weight, so the back leg is affected, and you try it again, and that time it drops a little bit, then they're still 3 of 5. They didn't make it to greater than 3 of 5. And then if it doesn't, when they get to the point they don't drop, then it's a greater than 3 of 5.
Yeah.
And there are certain exercises I'll do. And I definitely look at every patient as an individual. So it's not like, it's like, here's your course, and this is what you're going to do it each week, because it totally depends on how that animal progresses.
Yeah.
Yeah.
Yeah, absolutely. So, I mean, rehab and arthritis is obviously not the only thing that we think about in senior pets. So we're also kind of going to talk about some other senior issues as well, and maybe swing back to arthritis again, too, because it's so prevalent.
We have a couple questions if you want.
We've got questions from the viewers.
Does acupuncture play a role in the treatment plan?
It totally
You can talk a little bit. I mean, we have a very superficial knowledge of acupuncture. You may know more about how that integrates into your practice.
Yeah.
It actually, so I was trained like totally rehab and not on acupuncture, but at the same time, with Dr. Shinohara practicing acupuncture here, we've definitely had patients that will see both of us. And what's amazing is some of them have responded better to one and some of them responded better to the other. Like I've had patients that came to me and said, like, well, we weren't quite getting where we were, and then they started to get a little better, and part of that's time, part of that's that they did continue or didn't, and then other ones that just weren't responding to me and they saw NACO, and then that was like the stuff that got them feeling a lot better too. So we definitely had both. Yeah.
And these two kind of go together. Swimming, is it good for recovery? And what is the underwater treadmill used for?
Yeah.
Oh, great question. So the questions are, swimming and underwater treadmill, are those sort of great modalities to use for patients?
and they're really, really great. What's really neat about them is so the biggest thing is buoyancy factor. So it takes the weight off of the dog, the limb that's affected, right? So swimming's great for that. And then underwater treadmill does the same thing. Dogs can start to walk a little bit earlier. The thing on underwater treadmill versus swimming that's really kind of neat is that it's actually gait retraining. But swimming kind of does the same too. You don't limp when you're swimming. So a dog will use all their limbs equally, even when swimming. And when they're in the treadmill, same thing. So part of what we're trying to do when they're coming back from an injury is getting to retrain the neuromuscular fibers to fire in the same way they used to get the gait to go back to normal. And when they're not worried about the pain or the sensitivity, that helps. And also the resistance of the water trains them back into a normal gait.
Right, the muscle, because it's supposed to be that the water provides resistance in both phases of the gait, right?
Of the gait, exactly, yeah. And so you start with the water high, it's high buoyancy and low resistance, and then it starts to drop, and the lower it drops, the more weight they're carrying and the more resistance they're facing. So you can use it that way. And then swimming is great because it allows them to take that weight off, it's higher resistance and stuff like that. But the big thing with swimming, and we've already said that, even general practitioners have said this for a while, is that the swimming part's great. Jumping off the dock to start swimming or coming out of the water, my dogs always went into what we call the scuttlebutt mode. The swimming, they come out and they tear back and forth.
They do.
Yeah.
That's the
crazy.
worst thing
Right.
you could do for an injury. And sometimes in the sand. So,
Right. And then they also want to dive in funny positions and everything. They probably re-injure themselves, right?
Swimming's good.
Yeah.
That is true.
They must do that, though, coming out of the underwater treadmill, too, though, don't they? I guess you have a more controlled situation.
You're controlling the air. Yeah, my dog, anytime she gets wet, she just flies.
Freaks
she
out.
flies. Loves it. Yeah. So I can imagine that'd be bad.
Do we have other questions?
That was it.
No.
For now.
Oh.
On to senior pets.
Yeah, so senior pets. What do you think about as the age? Like, always a question: is my dog senior now, and do I need to switch to a senior food?
That's actually a
how
really
old
good
are
question.
they?
Because I feel like people want like an exact cutoff, just like people always sort of think. Every dog year is really 7 years, that's sort of been disproved, that's not really true. You have to look at the type of dog, like the breed of dog, any other factors. So I hate, I feel like people don't want their dog to be a senior, so I always kind of like extend it out a little bit.
You want it for the discounts.
Right. There's no movie pass discounts when you're a senior dog. No, but I do think it's the breed, and I think it's the breed of dog, because the smaller guys tend to live a little bit longer. Unfortunately, a Great Dane, you don't see that many, 15-year-old Great Danes. You can see a 15-year-old miniature pinscher or, other types of small breed dogs. So it definitely depends on the breed. And I do feel as though with our senior pets, we do... is sort of those are the pets that need more of the rehab more often than the smaller guys. Because I feel like younger guys, just like younger people, seem to bounce back fairly quickly from injuries and things like that. Whereas the older dogs are going to be the ones that end up going and seeing you for the most part, right? Would you not agree?
Yep. Well, yeah. Even if it's after surgery, it's like, they all can benefit from it. But after most injuries, like a sprain, it's just like I'm at the age now where like, my son sprains his ankle and he's fine the next day, and I sprained my ankle and I'm still working on it.
So I don't know. I think like with labs, I normally say like labs and Goldens. I don't know. By the time they're getting up, dogs. I think they're kind of getting around like 8. You start getting to be senior. What do you think?
Yeah. I usually say the little ones 10, right? And then medium-sized dogs 11 or younger. 8 or 9, and the large breeds 7 or 8. And a giant breed. What do you think? Like a Great Dane?
I still say for giant breeds, Great Danes like 6,
5 or 6.
I really do. Because they just I know
and
those big guys.
We're hedging a little bit too because it really does depend on the dog. I mean, you think about this for people. When is a person considered a senior citizen?
It's so true.
Well, most of that actually is for the discounts, truthfully, or when you start getting the ARP, right?
Yeah.
And it's just the kind of thing that, some physicians would say it's this cutoff or it's this cutoff, or it's when we start to change the medical treatment for the patient.
Yeah, I do. I feel like as far as the senior pets go, I mean, some of the big things that we see as we're getting or approaching those senior years, I really try to like hone in on nutrition. Like if they have an overweight patient or, it's a a bigger dog that's a little bit overweight and you're entering into those senior years, I do get worried about arthritis and stuff. This is the time we should really get that weight off. You've slacked a little bit and the weight's gone on. And this is not good for the patient.
Worry about the diabetes coming on.
All that stuff. Yeah, you just worry about that. It's not good for them for sure. So I do, not that you don't worry about that all the time, but it's starting to get serious at that point. And then we start talking about things like joint supplements, glucosamines, chondroitins, these are things that maybe we should be starting to think about.
Do you work with patients that are coming in for arthritis but are severely overweight and trying to give them some sort of a dietary management and weight management plan?
Yep. Yeah. And so, and so the nice thing on that is I'll work both with diet and, again, I'm trying to give them an exercise schedule, too.
Right.
Yeah.
And so hopefully we're actually increasing the metabolic demand for them, too.
Yeah.
And I feel like a lot of times, people have such a hard time getting weight off their patients, like, whether it be their indoor cat or their dog. But the fact of the matter is that, unless they're out there hunting on their own and consuming calories unsupervised, we do control what goes in, and we control how many calories are burned with like the exercise pretty much. So if you are a dedicated owner, you really can do the math and work that weight down in a slow, effective way that will really help them overall.
It's much more manageable than it is, I think, in people where we have so many psychological and other factors. And yeah, technically I control everything that goes into my mouth, but I don't control the cookies that appear downstairs in the kitchen or, the things
we have
I really
oh
want.
God, I know.
We have a lot of stuff. Please bring us fruit.
Yes.
So, I think that my biggest thing with senior pets is that the whole lifespan of the animal is really a continuum, right? Mm-hmm. So I don't want genuinely people to kind of change what they're doing in that senior pet. I want them to think about what is my senior going to need when the pet is one almost. It's kind of, I don't know, does that sound fatalistic or something like that? But that, when they're one, I don't want them to just like, everything's fine like you do in college, and then you decide now at the age of 45 I'm going to get in shape. Well, it would have been easier to get in shape when you were 20.
Right. No, that makes sense. Yeah.
So I do, unfortunately we can't always do that, but the thing that I see so often is owners pulling back on their pet care as they get older instead of actually increasing. I don't know if you noticed that.
Yeah, I actually had a patient that the owner stopped giving heartworm preventative. Right. And the dog was consistently negative on heartworm test, and when he turned 10, he actually tested positive, and he truly was. He was a true heartworm positive dog that just stopped for the past year and a half getting heartworm preventative because, he's 10 and a half. What does he need it for? I do think those preventatives are really important, and not just for fleas and ticks, but heartworm medication. People, sometimes it's a hard sell for people to say, well, why does my dog need it? He's 10, he's been fine this whole time. He's been fine because he's been on it. And
I've never had a problem syndrome.
So that's, I've never had a problem. Right, yeah. I do think that the care is really important because you don't want them to develop issues as they get older. It's not going to make it any easier being a senior and having Lyme disease or having.
You can still get all of those things.
Yeah.
What do you guys recommend for if let's say an owner really wants to do everything for their pet? So they've been coming here every year for their annual visit and their vaccines and doing all their heartworm prevention, so they're all on board with that.
Yeah.
Now this little Yorkie turned 10, and what has changed? What do you want to do that's different?
I the continuum idea you said, I still kind of keep that way. I feel like if that 10-year-old is still eating well, playful, joining in all the activities, jumping in and out of the car the way they used to, showing that they're not slowing down at all, and their weight's maintaining, and that's one of the big things, that they're just staying steady there. I don't necessarily change anything from where they were. So like when do they become a senior? I think, it's almost like, well, they kind of
when do they start to act like
when they start to act like a senior. Yeah. Like, oh, he's slowing down. Okay, why is he slowing down? Now let's look into that.
Yeah.
Is it something that changed in his diet? Is it something we need to look at metabolically, or is it musculoskeletal? But like, it's like, I kind of again, it's each individual. Like they
I think too, if the owners are like, really wanting prevention and things like that, if we can see those patients like every 6 months, even if it's just a pop-in visit, like let's make sure they haven't developed a heart murmur, that we could, scan before and make sure there's nothing that's there that we need to worry about, as opposed to waiting a full year. You're sort of catching it sort of midway. And if their teeth are, they fractured a tooth, or, they have enough dental disease, those are the patients, people are always hesitant to do dentals on older patients and do these things. But I say to people, I don't do extensive big dentals on a 1-year-old dog. I'm doing them on older patients that have had time to have that tartar and plaque and dental disease time to build up. And so, those are the patients we should be doing dentals on. We shouldn't just be saying, oh, he's 10, so I'm not going to do a dental. Right. That's exactly the patient you should do a dental on, to make them more comfortable, prevent any infection. And
the idea that, like, well, I'm nervous about the anesthesia, so I've never wanted to do it. And
right.
Instead of, how about go early, because the duration of the procedure becomes important. And so, like, the earlier you act, the shorter the procedure, and all that kind of thing.
Yeah, that's what I've told people, too, is that whole idea of the continuum is, why I'm recommending it maybe at the age of 7 is because I'd rather that we do short procedures once a year rather than have to, wait. And now we have a 16-year-old that has heart murmur and kidney disease, and now its teeth are such a crisis, and we have to spend 3 hours under anesthesia. Like, not great. And actually, I have a couple of patients that are 18 or 19 that I've told the owners, I don't want to do the teeth now, and the reason I don't is because you've done a great job, and we've done the teeth every single year, and they don't need it. Like, they're not in a crisis. They have more tartar than you're happy with or comfortable with, but it's not causing any problems right now. So now we can enjoy our senior lives.
Yes.
Because they're definitively a senior at that age.
Yeah. Oh, sure. They're maybe geriatric at that age. Geriatric generally means past the a normal lifespan of the pet is kind of the definition.
They're on the Smucker's jar from what was that guy's name? The Will. Oh, he did the channel. He would do the NBC News. Don't you know who I'm talking about?
No.
A viewer. There's got to be a viewer here.
Somebody's going to put it up.
Somebody's got to put it up. He's on the Smucker's jar. It's on the Today Show. That old guy retired down to Florida. Oh,
Wilford Brimley?
No.
Okay. Well, we'll
see if a viewer gets it. Viewer's going to understand.
And then kind of so I agree with you there too, like diet. I don't necessarily jump to changing over to those senior diets. I will if everything's, okay, they're kind of optimized for senior nutrition. The proteins are a little bit more easily digestible and maybe readily available for nutrition. They'll often have glucosamine in there, so that helps a little bit with joints. But there's nothing magical necessarily, I think, about a senior diet versus an adult diet. I don't know if you guys
I think you can buy the supplements too, and I feel fine.
So how do we feel about joint supplements? That's something I get a common question for the seniors.
Yeah, I'll let you start, Mike. I mean, I can start. I mean, I have no problem.
She can always
with it.
start.
I can always start. I have no problem starting. I mean, I have no problem with them. I think that if they're going to work, they have some beneficial qualities to them. If a patient for some reason takes them and gets diarrhea, then it's not
for them.
Not for them. Yeah. But I have no problem with them, and I would love if my senior patients were on them.
Yeah, I definitely use them, and I always preface that with like if you give an anti-inflammatory, it's going to work in an expected way. Yeah. But the supplements, like some dogs respond really well to them, and some don't. Right. And so it's worth trying. Mm-hmm. And I like fish oils a lot as much as like glucosamine. Yeah. I like that one too, and the combination, multimodal, getting both of those in. Yeah. And I'll always say, like, try it for at least a month or so, and then if you're wondering about it, stop. And notice sometimes it's like you don't see it get better, but then they get worse. So, but it's
interesting.
Yeah, they're one of those things that you have to be a little bit not so much careful with the joint supplements and other supplements, because I don't think they can't do harm, but there's all this question of their quality control and all of that. And so recognize that vitamins and joint supplements are really something that aren't regulated by the FDA, because there is this specific supplement act that says that the FDA doesn't regulate them the way they regulate drugs. So there have been studies that say, well, this amount of glucosamine wasn't in these pills. Mm-hmm. So I would say quality does matter, and I would choose, a manufacturer that is known to have good quality control. There are some veterinary ones that do provide good quality control. And if you don't see a change on one, maybe try a different brand.
Yeah. We do have a question.
Yep.
Did somebody remember the Smucker's jar name?
No.
Oh, okay.
Oh.
Sorry about that.
God, we could Google it, but we're not gonna.
We have two viewers that are kind of telling stories, but one of them from Joan. She was just telling us that she lost her golden at 9, and she can't help but think if she came in every 6 months, if she would have caught something.
Oh.
Do you recommend when 9 is young, but coming in at senior every 6 months?
So Joan we have a viewer that said that she had unfortunately lost her golden retriever at 9 years old, which is very sad. And she wanted to know if she had come in every 6 months, that maybe she could have caught whatever it was that, her dog had. Honestly, it does depend. I mean, sometimes we can get lucky. I'm going to, in my mind, that her 9-year-old golden might have had a hemangiosarcoma on her spleen, might have had something a type of cancer that sometimes are really aggressive, and you could have seen the pet 2 months before and not seen anything wrong with the pet, and all of a sudden the pet's coming into the emergency room in a crisis or has passed. So there are some things.
Reliably
Yeah.
save the pet. It's you hope that sometimes.
Yeah.
I think, my big rule, so I kind of try to treat my patients the way I treat my own dog, with the caveat that I truthfully can't always talk owners in or even commit my brain to talking owners into doing as much blood work as I do on my dog.
Yes.
Let's just say that.
Yeah.
So there's a lot of things you can pick up early. We do exams for heart murmurs. We do blood work routinely. At that age of 10, when they become a senior, or maybe it's 8, or maybe it's 5 in a Great Dane, you're doing some blood work just to see if there anything early that we can detect. There's a lot of things we can detect early, but not everything. And cancer is one of those things that is difficult because there's not a lot of early testing for cancer in dogs and cats. We don't have, markers that we can really test for. So I remember this surgical resident when I was in vet school. He had a German Shepherd, and they're known for some of those kinds of cancers. He used to have that dog ultrasounded, I think, every 3 months, just to see if he could find the splenic tumor early.
Yeah.
I don't know what became of that dog, but I was just like, that poor dog had its belly shaved.
All the time.
Just shaved belly. And I don't know, maybe that could save him, but maybe still, once you see it on ultrasound, is it too late to have already spread? It's hard to know.
It's hard to know. I mean, what I would say is it's not wrong to bring your pet in and have them evaluated. And if there is something that we can catch or pick up, we hopefully will do so. But that it is definitely not foolproof. And unfortunately, things like that do happen.
She wrote in that she lost him to renal failure.
Renal failure. Oh.
Now, so, I mean, it may have been detectable early.
Yeah.
It's hard to...
9 is young.
Yeah, 9 is very young.
Yeah.
To believe, obviously we practice medicine in as conscientious a way as we possibly can, and we don't do things for no reason, right? So I see those patients. How often do you see the cat that comes in that's never seen a vet and it's 15?
Right. And
great, it's 15, but it comes in with 8 or 9 different problems. It's got rotting teeth, it has a heart murmur, it has an abdominal mass.
Right.
That's the profile of those animals that don't see a vet and then come in for something kind of at the end. And we don't have a lot of options then.
Right.
We would have, 5 years ago, we could have cleaned its teeth and maybe had a cardiologist take a look and get it started on heart meds and maybe detected that mass a little early.
Right.
It's hard to say.
And I do think this sort of brings up, and this is kind of off topic in some ways, but I mean, going back to our viewer, I mean, I think we are so hard on ourselves too about
Guilt.
if I miss something or could I have done something. Obviously you're a great pet owner that cares for your dog and everything, and still
you're watching this podcast.
And you're watching the podcast, which means you want to learn about animals, which I love. But don't be too hard on yourself, because sometimes they can get sick so fast, and it's not your fault, and it's something that you did wrong. And just loving and caring for them, it can be hard. It can be very daunting.
And
Do you have another question?
More of a story in comparison. So another viewer, Brianne, I believe her name was. She had a 14-year-old.
So this is a viewer, Brianne, who had a 14-year-old.
And that animal passed and never showed a sign of slowing down.
Yeah,
so
see.
it's just opposites. Really.
Yeah, so her pet was 14, never showed a sign of slowing down, and just passed. I mean, and just think about it like in people. I mean, there are...
A 125-year-old lady that lives somewhere.
Right.
That's on a smucker's jar.
It's on the smucker's jar. Right.
But no, there's also, those horrible tragic stories of people that have an aneurysm or have a heart attack and they seem fine beforehand. And it happens with our patients too. And even if those people are going to a doctor, I mean, even that guy, the physical trainer, what was his name? On The Biggest Loser. Nobody else is going to help me with this one either. That had a heart attack. He had a heart attack. Right. So, I mean, he's supposed to be this, like, ideal image of somebody that's, like, really in shape and, has a heart attack, that if he didn't have a physician at his gym having a, defibrillator, he would have died. So, you just never know. You never know. But hopefully by screening and frequent visits, we'll be able to sort through a lot of that stuff.
Yeah, so do you guys have I was going to kind of give you my, like, perfect, if I could do everything perfectly and I didn't have any there were no financial questions. Okay. How would I manage a senior pet? I think I'll throw mine out there that, probably at the age that I determine that they're senior.
Yeah.
I would certainly say that doing annual blood work would be ideal.
Yeah.
And probably a urine.
Yeah.
Yep. If not blood work, at least a urine, because you can actually pick up a lot on those. I would definitely continue with my regular preventative care. Vaccinations, sometimes we reduce those a little bit as they get older, but not too many of them. Honestly, you have to do rabies by law.
Right.
Lyme and lepto, they don't get any increased immunity to. Cats
and unfortunately, the vaccines aren't as protective.
Right.
Like
right. You have to keep doing them every year.
Right.
Yeah, but
so I might reduce my canine distemper, my feline distemper vaccines, and I don't think that I would do a lot of imaging. I don't think I would do chest X-rays annually or ultrasounds.
Maybe blood pressure. Blood pressure is the one that I don't do as often as I think that would be a good thing to add. It's kind of a pain
to do.
Yeah, and that would maybe be one to add more.
Yeah, and our veterinary patients, we have to shave a little area of their...
Gosh,
it's really tough. And then you have to listen with a little tiny, like, probe to listen to their heartbeats. It's a bit different than in humans.
And then the cat's flicking its paw and the dog's bouncing around.
They don't relax.
Yeah.
They will. A lot of them will eventually, but it's just not.
It's just harder.
Yeah.
And I do recommend doing the dentistries as a preventative measure, not just when their teeth are rotten.
Yeah.
So that's kind of my protocol. Do you guys change it?
Yeah. No, it sounds very similar to mine. Yeah, making sure they're still doing the preventatives, making sure that again, I go back to weight because I do feel like they creep up. I do, and not that it's not ideal to keep them always in the best body shape. I have also creeped up. Had a few litters. It doesn't help. But no, I feel as though if we can watch that too, because I do feel like the senior pets that have a lot of extra weight on. Again, I think about the labs and the Goldens and stuff. That if they're a little bit extra.
Well, did you guys see that recent study that came out? I mean, there occasionally are studies on weight in pets, but this one kind of definitively. I mean, it, right? But 2.5 years longer they live if they're not overweight.
Yeah, it's big. It's a big deal.
Yeah, and that weight is really such a great thing to watch too, because then on the other end of things, if they start dipping,
right?
Did you cut back? No. Okay, then now is our time when we know. Let's look
so even if you haven't done the routine blood work all along, do it now.
Right. So if you're coming every 6 months and weighing, then you catch that part of it.
Yes.
Yeah. I also think that every 6 months helps with just kind of their general look. Like, don't you sometimes get those pets that come in and you're like, gosh, you've got a lot of gross dandruff and all of a sudden... The cat's
hair coat's getting a little rougher.
Yeah, so the cat's not really grooming itself as well. You could just detect something's off here.
Yeah. We have another question from...
So I got... One is just a story, and that's from Kelly, just saying that she loves you, Mike. And
Kelly, we have a viewer.
We have a viewer who loves Mike.
She has a 5-year-old Newfoundland that Darth Vader.
Yeah.
Oh, Darth Vader.
Yes, well named.
That's very
yeah.
And then Brienne, when do you recommend starting dentals?
When do you recommend starting dentals? Complicated answer. I recommend starting it when they need it.
Yeah, because you can have some patients that really don't need it for a while. They have minimal.
How do you decide when they need it?
I think when you start to see evidence of tartar and plaque buildup, that you're starting to get worried. Okay, this is too much, or you're starting to maybe see evidence of gingivitis for sure. You gotta,
gingivitis.
Yeah.
I look for that little rim of red around the gums. So tartar itself on the top of the teeth is gross looking and it's smelly, but it's not necessarily. That's not the problem.
No.
It's right at the gum line where the gum. If you can't see your pet's gum line, that's a problem.
That's a problem. Yeah.
But if you can, and it looks puffy, red, that's when to do it. You don't want to necessarily do it. So too early is not necessarily terrible, but you do, when you clean those teeth, you make these little tiny little micro scratches that are invisible, but now even though you polish, the tartar can kind of stick on just a little bit quicker. So we say, well, we'd rather keep that baby new tooth surface as long as possible. For some dogs, a little Chihuahua, maybe it's going to be a year of age.
Right, yeah. It can be that early. Absolutely, yeah.
I started my dog at 1.5.
Yeah.
She's a little dog.
But she's little.
I have a golden retriever owner. I mean, this dog's teeth look bright and white and shiny. It's 12.
Yeah.
Do they brush their dog's teeth though every day?
Not all of them. This person does, but yeah.
Well, this is one of the benefits.
I had one in the other day who the Labrador, like 10 and a half years old. They don't brush their teeth.
They don't always.
But they've always been good about giving them something to chew on.
Mm-hmm. Yeah.
And yeah, like wow.
Yeah, I do say, I feel like I've been here long enough where I've seen them as puppies and now as seniors, where if I've gotten those owners to buy into brushing at that visit when they're coming in at 11 years old, those dogs' teeth, and it's not a large percentage of people that will brush every single day.
No, don't feel guilty.
Don't feel guilty, because I also don't.
Do you brush your dog's teeth? No, I don't.
So, I mean, I don't want you to feel guilty, but the people that do, that really buy in and want to do it,
it does help.
Oh, it makes such a big difference. And so you can get the genetic factor where some dogs' teeth just don't seem to build up.
Or just the bacteria that they have in their mouth.
Right.
I always tell people, like, you can get lucky that you might get like 11 years and never need it, but often you will, because I brush my teeth twice a day, and if I didn't see my dentist,
yes,
I would still be in trouble.
And I'll give this word of advice to owners, which is a little insight into veterinary psychology, which is if your vet is recommending a dentistry, they think it's necessary. So this is one thing where it is hard to recommend a procedure for your pet that costs X amount of dollars, that's going to be anesthetic, that we have to do blood work ahead of, and that leap of making that recommendation for vets can be challenging, and it also depends on the personality of the vet and how much they're bought into it. But if I'm telling you, I think we should clean your dog's teeth now, I actually mean it, and I'm probably not gonna go crazy twisting your arm. I'm not gonna say you're terrible if you don't, but I think it's necessary. And there are some vets they'll say, oh, we should probably think about doing the teeth, and the minute the owner says, I don't think so, they back off, and that's with good reason, because we kind of get shot down a lot.
Yeah, we don't want to feel pushy, but like that idea, like if we're advising the dentistry, it's kind of like if your dog comes in and they're limping, and we advise an anti-inflammatory, like
it's a treatment for a disease.
I wouldn't just give anti-inflammatories because it has its own risks, but in this case, I think it's right. Yeah.
And no vet wants to be the one that twisted the arm of an owner and really talked them into something that ends up there being any sort of a complication. So we have to be fully all bought into it, and that includes the owners too. So.
Yeah. Well, that sort of concludes our episode for today. Yeah. We appreciate everybody for tuning in. We appreciate our guest, Dr. Hornberger, for coming and talking to us all about it. Isn't it fun? It's a lot of fun here.
Yeah.
So please don't forget to find us on Google Play and iTunes. And we want to thank our sponsor, Ethos Veterinary Health. And we hope to see you guys next time. Signing off from the podcast.
She said signing off.
I did.